Hello, my name is L'Oreal Henderson, and this is my summary video of my video health assessment assignment. So overall, I think I did a pretty good job. I think I handled it as if I would in a normal situation if I was in a patient care situation, how I would talk to my patients. But normally, I would be a little more lax, a little more comfortable. I'm always trying to make my patients feel comfortable, so usually laughing, a joke or two here and there. But in this case, because it's for school, I wanted to make sure that I just kept it professional and straight to the point. Also, something that I noticed was I was talking faster than I normally would when doing an assessment with a patient. The time constraints was hard for me. The original video that I did, I went way over time, and that was just with the health assessment questions. So it was really hard trying to cut it down and cutting out questions that I wanted to ask that I felt were important, but I just didn't have time to ask all of the questions for each body system. I just didn't have the time to do that. So that was kind of hard trying to keep everything within 10 minutes because of course we know in a normal assessment it can take longer, and usually I'm taking my time really trying to get the background of the patient. So I was talking a little faster. Noticed I believe my body language was good. I think I did keep my professionalism with the patient like I would in a normal situation. I do get nervous under pressure, so I do notice at times I might get tongue-tied or stumble over words or stutter a little bit. And that just kind of happens when I feel like I'm on the spot or nervous or repeating some of the same words. And in a real case scenario, I usually don't do that. But in cases where I feel just nervous or on the spot, I do kind of just get nervous. And so my words kind of go like that. As far as expected outcomes for this assignment, when it comes to the use of the patient, the oral history of the patient, I really wanted to get more into detail and kind of introduction of my video. But again, the time, I know I didn't have a lot of time. But so now I'm just kind of explaining that the importance of oral history, or of us obtaining our patient's oral history as a provider, will provide us with kind of a baseline of the patient's care so that we can note how to further care for that patient when we're charting on that patient, and so that we can note how to address any needs and how to further assess them and just to provide the best care possible. So it's very important to get that background and health history from the patient. And another expected outcome was the use of physical examination techniques. So again, I tried my best in the time to use the techniques such as auscultating, palpating, inspecting with the stethoscope. Usually, of course, in a real life scenario, I would do it much longer. But in this case, as I mentioned in the video, I had to kind of go through it much quickly due to time. And then lastly, for an expected outcome was reviewing the assessment findings of a healthy patient. In my video, I would note that, if something was unremarkable or if there were no abnormalities detected. Again, I could have gone more into detail about different things, different type of gastrointestinal issues that could be noted if I hear something when I'm auscultating, or if I'm feeling something when I'm palpating. But due to the time limit, of course, I couldn't go through everything. But I tried to briefly hit some points in my video of different underlying conditions that certain things may indicate during my focused assessment. So I do feel like overall, I feel like I did a good job for my first video like this. Overall, I did a great job, and I feel like I did a good job. I hope I did a good job. I hope that I did cover all the necessary pointers. I tried really hard to, and I enjoyed doing this assignment. Thank you.